Thank you for inviting me. I'm Professional Officer for School Nursing at the Department of Health, and I lead the School Nurse Development Programme, which has been quite exciting and has led to quite a number of changes, but it's given us an opportunity as well to really start thinking about what's important for school nursing and what areas do we need to develop. And from the consultation we did with children and young people with British Youth Council, it was really clear that we needed to increase accessibility, but that wasn't necessarily about having a school nurse at every school on the school gate every day. It was actually about how could children and young people get in touch with you much more readily. And one of the key things that they came up with was they wanted you to use technology better. They wanted you to actually use text messaging, apps, and to actually be visible in that way. And one of the quotes that came back from the young people was, we need to be in sync with young people and the way they live their life. And I went to an event and I was early, and the speaker before me, who was the head of service, said, in the Department of Health had said this quote from a young person. Which young person would say anything as stupid as this? And I actually said, I know his name and address if you'd like it, and he was mortified. But that quote is really clearly from a young person. It was a young man actually, and overwhelmingly throughout that consultation, it was about 2,500 young people, so it wasn't just half a dozen, and they were from a huge variety of backgrounds, from right the way from Newcastle down to Bristol and everywhere in between. So it was really, really quite a useful piece of research. And following on from that, we really got a hook about technology, about social media, and we began to think, well, okay, if school nurses are going to need to be involved in this, what do we actually do to support the profession? So we had 2 seminars where we actually started bringing school nurses together, and we did a mini Twitter class at those events, but we also started unpicking some of the models that were happening around the country, what was actually going on and how were school nurses engaging. As a result of that, 2 things happened. One, we've now got approval to go forward in terms of developing a social media platform for school nurses to use professionally. So how many of you are on Twitter? A few, not as many as the group previously, but as a result of that first social media meeting that we had, we've now got a special hashtag that school nurses use, and that means then everybody that is a school nurse with an interest can actually connect. And what we've got now is about 250 school nurses that regularly use that hashtag. That's really useful because if ever you need anything, all you've got to do is actually put something out on Twitter, and you can guarantee within seconds, minutes, then you actually get something back. So somebody wanted a service specification and tweeted, and somebody else said, I've got one, I'll send it to you. And that's how things are happening, and that's growing and growing and growing. We held a WeChat with we nurses, it's nice music, with we nurses, to just pilot whether school nurses would actually use WeChat, and we were overwhelmed at the pace. I don't know if any of you joined that, but the pace of it was only an hour, but that hour disappeared really, really quickly. And looking through the transcript, there were some really interesting issues that people raised, right away from should school nurses wear uniforms, to actually how do we influence commissioners to actually give us more resources. So social media is really good professionally, and you get to see some fantastic cakes that people have made as well on there. So it's worth looking at it from that if you're not really wanting to extend your professional knowledge. But in terms of children and young people, I think it's really exciting time that we're thinking about social media, and a few areas are starting to actually engage with it and actually look at how can they involve children and young people much more readily in accessing services more freely. So something like that you've been piloting here in Leicester is absolutely groundbreaking and really, really fantastic. There isn't anything else that we've seen out there that has got the evidence base behind it and is so robust as what you've developed here. It's been a 9-month pilot, but actually what you've achieved in that time is really sustainable and will actually lead on to greater things. So we're quite excited about this. And it comes from a very, very simple idea, but actually, it doesn't hold any bounds where this could actually go. So I think this is really exciting. A few other areas have developed text messaging services, but they haven't actually got the backup about how this links into record keeping, etc. So this for me is really, really quite an opportunity to think about where this will actually lead to next. So I think you're at a really crucial time with this. And I just shared with the previous group, more and more of our clients are actually asking for social media and technology to be included in how we actually communicate. And we did some of the pilot work with parents of 2 to 3 year olds around childhood flu leaflets. And the overwhelming message that came back was, don't give us a leaflet, they're awful. We want a little credit card with a link to the app on it. So that was completely disregarded with the pilots this year, and they sent a leaflet out. But parents told us they didn't want it, they wanted access to an app to get that information. So it's something that's been taken on board. But I guess what I'm saying in a very long way is, social media is not just for children and young people. Actually, it cuts across our whole community. Professionally, it's fantastic. For children and young people, it's fantastic. And for parents. And I think it is not just the next generation, it's actually our generation. We need to be a bit smarter about the way we use it. So lots of activity nationally about how we use this. There's the National Technology Fund that can be used to support all of those approaches. So there's funding to support it. And if we are going to be really serious about reaching children and young people much more widely, then there aren't enough school nurses to go around. And we had a conversation previously about the number. There are 1,293 school nurses. You're not going to actually reach every child face to face, so we've got to think about different approaches, and this seems like a fantastic approach to be using. So it's great if you can embrace it and take it forward, but I would urge you to get onto Twitter and start following.